Welcome to another edition of This is Public Health, a podcast presented by the Illinois Department of Public Health. Each new edition focuses on an area of public health and programs and services that affect you. This week, we're taking a closer look at the important work being done by IDPH Laboratories, and we're pleased to welcome Charles Williams, Bureau Chief of Testing for IDPH. Charles, thanks so much for taking the time. We appreciate it.
Jim, thank you. It's a pleasure to be with you.
Well, we're just coming through the observance of Public Health Laboratories Week across America. So let's begin with just an overview. Why are public health laboratories so important? What role do they play in ensuring the health of our state and our nation?
Well, Jim, we do have a lot to celebrate with Laboratory Week. Most of us are familiar with labs when it comes to seeing our doctors. We may go in and we might get a CBC, a cholesterol to understand our individual health. Many times where the public is not familiar with the work of our public health laboratories. Public health laboratories are a network of public funded laboratories. These may be state or local or regional labs. They may be at the city level or county level, but these labs perform specialized testing that aims to prevent and control disease at the population level. And so we perform critical surveillance at the population level to really understand what is circulating in order to prevent the transmission of some really critical diseases that could affect our population. I will never forget where I was in 2015. I was working as a hospital administrator, and this was the time when Ebola represented in the population. And we were really hastily getting prepared to receive patients into the hospital who may have traveled to places where Ebola was spiking. And, so while we were preparing to isolate those patients and, apply travel criteria, what I really didn't understand is once we collect a sample, there is a public health lab that handles that highly contagious disease. And so really, public health labs are really the backbone of our public health system when it comes to infectious diseases that could really spread rapidly through the population and other forms of bioterrorism and chemical threats that could pose a threat to our public's health. Public health labs are really kind of the unsung heroes, if you will, of the public health and healthcare system.
It's such a remarkable example you point to in the labs, are often handling things we would consider fairly routine surveillance of diseases and sometimes things that spring up seemingly from out of nowhere and become something that has to be addressed immediately. And you can't do that without the knowledge provided by those labs. Now, as part of the observance of Public Health Laboratories Week, Director Vora, the IDPH director, Dr. Samir Vora, made visits to the three major lab facilities operated by the department in Chicago, Springfield, and Carbondale. Tell me a bit about each of those facilities. What do they have in common and how do they differ?
So yes, Jim, in Illinois, we have three public health laboratories, and they're based in Chicago in the north, Springfield, center of our state, and Carbondale in the south. All three labs provide rapid clinical diagnostic services and also environmental testing. And so all three of our labs are fully equipped and CLIA certified, which is our Clinical Laboratory Improvement Amendment. That's basically a designation from the Centers for Medicaid and Medicare Services. But all of our laboratories are CLIA certified for diagnostic testing for a number of diseases, ranging from respiratory viruses such as tuberculosis, which just like Ebola can really rapidly spread through the population, is critical that we contain it. Tests for COVID and flu, as we know, kills scores of people every year across our nation. Upwards of about 9 million illnesses throughout our population and about 50,000 or so deaths from flu. So we test for flu, we test for COVID. We also test for some gastrointestinal pathogens, Salmonella, E. coli. We test water samples and environmental. All of our labs are equipped with a range of clinical testing and environmental testing. Now, the difference is Chicago lab houses our newborn screening section, which we actually perform testing on nearly every baby that's born in the state of Illinois. And we test for genetic or inheritable disorders that could really pose a threat to the baby's ability to develop and thrive. In some cases, these disorders may lead to death. And it's critical because many of the disorders we test for out of our newborn screening lab, there's a small window of opportunity to diagnose and treat those rare disorders. And so this is a large production, as you can imagine, where we receive samples from all of the hospitals around our state. They come to our Chicago lab and we test those on a daily basis and get those results back to the hospitals so that families can really understand if there are any threats to the health of their newborn babies. And so, it's just such a vital service that we provide. 150,000 or so births in the state of Illinois, and we test most of those babies, nearly all of those babies. And so very critical testing that goes on in Chicago. Also, that houses our tuberculosis section where we test for TB. And then in Carbondale, that's where our HIV and sexually transmitted infections, that's where we test for those down in Carbondale. And then Legionella is conducted in Springfield. Malaria is also in Springfield. And so, again, critical diseases that we're testing for across these laboratories. When we look at our long-term care facilities and nursing homes, it's just so critical that there is a public health laboratory that if we see symptoms in these nursing homes, those samples are sent to the public health laboratory to really understand what's circulating, what's going on, identify that disease and prevent and contain it. So that's just another example of the amazing work that's done across these 3 labs.
You're listening to This is Public Health with the Illinois Department of Public Health, and our guest this week, Charles Williams, Chief of Testing for IDPH. I wanted to stop for just a moment because, so many extraordinary things these labs do that help with early detection and pinpointing where intervention is needed. And one area people may have heard a lot about, particularly during the COVID-19 public health emergency, was wastewater surveillance. This is really fascinating to me. Explain what we mean by wastewater surveillance and what does it tell us? What kind of clues does it yield about health in our state?
Well, Jim, wastewater-based epidemiology is an emerging methodology here in the U.S., but it's actually been going on. It's been going on overseas, but I would say that it really developed in the U.S. during COVID. What we learned was that patients shed this virus in their stool even before they present with symptoms. And so what that allows us to do is then we can, because it's shedding already, we can then collect specimens from our wastewater treatment plants. We can take those specimens to our laboratory, and then we can analyze those specimens and test them for the presence of that disease. So during COVID, we launched our wastewater surveillance program here in Illinois. And our program has about 80 treatment plants that represent over 47 counties. They cover about 47 counties, and over 80% of the population is covered on sewer systems that are going into the treatment plants from which we collect our samples. So what that has allowed us to do is to, on a twice per week basis, we collect those samples, and we've been monitoring those samples for the presence of COVID, flu, and RSV. You may recall, Jim, when there was a spike in RSV and we saw our babies that were, some of them were presenting in our emergency rooms and having to be admitted and on ventilators at that time. And we are able to monitor the wastewater. And in the case of COVID, we see 7 to 10 days, we see spikes in the wastewater prior to spikes in the clinical setting. So prior to there being, for instance, constraints in terms of bed availability, this allows us to say, okay, we're seeing a major spike in our wastewater. We look at that alongside of other variables, and then we make public health decisions on that allow us to direct resources, including testing in certain areas where we're seeing a spike in the wastewater in a certain county. We may direct testing to that county, increase testing so that we can identify those cases and isolate. And so you can imagine that this became a very useful tool during the pandemic. And since then, we've been looking at ways to expand the use of this tool into other areas. One of those areas, for example, is opioid testing. We're examining that right now as a possibility, and we're engaging our stakeholders to see if this is going to be a tool that is going to be valuable for use in the community for monitoring new designer drugs that may be starting to circulate in a community. This will allow us from a public health standpoint to direct therapy, prevention. So if we see a new opioid and maybe, for instance, the treatment for this new emerging drug, it may not be as responsive to the current treatments. And so, we can get ahead of it. So this is an example of us being able to use it in a very prospective way. By looking at the wastewater, we can assess what's circulating in the community and then put mitigation strategies in place so that we can reduce the burden, disease, and negative health outcomes in the case of opioids. So that's just an example.
Well, unfortunately, we're nearly out of time. And before I let you go, I want to talk a little bit about the manpower, the workforce in the labs. What kind of training is required to work in public health labs, and what are the career opportunities within our labs?
Well, Jim, these are highly trained professionals. All of our clinical testing requires a minimum of a bachelor's degree in chemistry, biology, or an equivalent physical science. So that's what's required. That said, I can't tell you, for Lab Week, we gave out service awards for years of dedicated service for our lab professionals. And I can just tell you, Jim, you'd be amazed by the number of staff who've been here 25, 30, 35 years. Many may have started out at a technician role and may have climbed up to scientists. And so, there's a ladder of upward mobility. There's opportunities within the lab, and it's a great place to start a career and to have longevity. And really, you never hear about laboratory professionals, but their work is truly essential to our public health and healthcare system. And, as we move into new technology, the laboratory is going to be the place to be. One of the new areas that we're advancing is genomic sequencing. Our laboratory is performing sequencing of viruses, and it's really helping us, for instance, take COVID. We know that COVID of 2020 is not the same COVID of 2023 and 2024. There are many variants that have pervaded our population, and we perform a very highly technical genomic sequencing of this virus to understand what's pervading in the population, and that allows us to get ahead of it. Some of these variants may be more infectious, some of them may not respond to treatment the same, but we are at the forefront in our laboratory with really understanding and characterizing certain diseases so that we can, as the public health and healthcare, respond to these diseases effectively and preserve life.
Truly fascinating, interesting, and important work being done in our public health laboratories here in Illinois. Thanks for sharing the information with us, Charles Williams, Bureau Chief of Testing for IDPH. We appreciate your time here.
Thank you, Jim. It's been a pleasure.
Join us next time for another edition of This is Public Health with the Illinois Department of Public Health.